there, I'm Dr. Malescu, and I am Assistant Professor at Daytona State College, teaching A&P1 and A&P2. So today's lesson is on urinary system. So I'm going to go over first this lab model on the kidney, and then we're going to go over learning about the nephron. These nephrons are within the kidney, specifically in the renal pyramid, which we're going to go over, and then showing you the glomerulus model. All right, so let's take a peek here, and we're going to go over all the parts. I'm going to go out of vision here. There I am, and you're going to see a nice image here of my kidney model here. So this kidney lab model is basically your standard kidney and the anatomy involved. So let's go over it. So we're going to start with identification of the renal artery, as you can see here. The renal artery divides into segmental, as you can see here. Segmental divides into interlobar, as you can see here. And then if I flip it this way, I don't know if you can see, but you can see the arcuate, as you see right there. The arcuate is pretty much going to be just like this over the base of the renal pyramid. So this is basically a renal pyramid right here, and the arcuate is at the base of the renal pyramid. And then you can see the apex of the pyramid, that pointy section that I'm pointing to, that's the renal papilla, which opens up into the minor calyx. Okay, so I digress. I want to finish up the vascular portion. So one more time recap. Renal artery divides into segmental, as you can see, segmental. And then once you get up in between the renal pyramids in this renal column area, you're going to see the interlobar arteries. And then from the interlobar, it branches out into the arcuate artery. So the blood flows into the arcuate artery. And then this oxygenated blood spreads across the cortex, the renal cortex, via the cortical radiate arteries, as you can see here. Then the cortical radiate arteries are going to feed into the nephron system, which if I bring this out, you're going to see that the nephron system, this is one nephron, here's another nephron, here's another nephron. So the incoming afferent arterial, so let's show you. So right here is the incoming afferent arterial, and then you've got the outgoing efferent arterial. And from there, it goes around the peritubular capillary. From there, it goes down the Vasa Recta. And now you can see here it's oxygenated. By the time you get down from the descending loop of Henle and go up the ascending loop of Henle, the Vasa Recta on the ascending loop of Henle, this capillary network called the Vasa Recta, as it rises up the ascending loop of Henle, you have now reached the point where the blood is deoxygenated. All right, what happens next? It feeds into this vein right here, which is going to be identified as the cortical radiate vein. So let's go back to the original model, and let's show you that the cortical radiate vein is right here adjacent and running parallel to the cortical radiate artery. So cortical radiate vein feeds into the arcuate, which feeds into interlobar, as you can see right here, interlobar into segmental, as you can see here, and from segmental into the renal vein that you can see right there. And then from the renal vein going back up the inferior vena cava back to the heart, via the right side of the heart, via the inferior vena cava. Okay, so we just went over the blood flow in and out of the kidney. Okay, we learned that the renal artery divides into segmental, which divides into interlobar artery, into arcuate artery, into cortical radiate. From cortical radiate, it feeds into the glomerulus. The glomerulus is right in here. You can see the glomerulus within the glomerular capsule. So these are all the glomeruli. Okay, so there's your afferent arterial that I'm pointing to, entering the glomerular capsule. Exiting is the efferent arterial. So afferent is here, efferent is there. And as you can see, it goes around the peritubular capillary right here, proximal convoluted tubule, peritubular capillary around the proximal convoluted tubule. It descends down the descending loop of Henle, up the ascending loop of Henle. This is called the Vasa Recta. And as you can see, it immediately feeds into the cortical radiate vein right here. Cortical radiate vein is going to feed into, recap, arcuate vein, there it is. Arcuate vein into interlobar vein into segmental vein into the renal vein, and back to the heart. Okay, so we did the blood flow through the heart. Now we're gonna go over the structure, the nephron, and the parts, the segments of a nephron. A nephron is the unit that is going to filter the blood and form filtrate, which eventually becomes urine. So we have 1 million of these in the renal pyramid. So these are the renal pyramids. In between the renal pyramids, we have the renal columns. The renal pyramids are where these nephrons reside. And if you remember, the medulla is the center, the cortex is the outside. Pretty much most of the nephrons, the portion of a nephron is around the cortex, but the loop of Henle, okay, and the collecting duct is going to be in the medulla. All right, so let's go over some structures in the kidney before I go on to the nephron. I'm sorry I'm jumping back and forth, but that's the way the kidney looks. It's pretty complex and things are going on simultaneously. So we talked about how inside these renal pyramids, we have 1 million of those nephrons, which are filtering blood. Great, we're forming filtrate and it's coming out of the renal papilla, as you can see right here. From the renal papilla, it feeds into the minor calyx, as you can see here, which then feeds into the major calyx. So what's the difference between the minor calyx and the major calyx? These are the small canals that they feed into, meaning the urine. And then the larger canal is the major calyx. So the major calyx feeds into the renal pelvis, the ureter. From the ureter, it goes to the bladder. From the bladder, it goes out of the urethra and to the toilet. Okay, so that is the structure of the kidney and the entire urinary system. Now, we're going to go over the nephron and then finally go over the glomerulus, which is part of the nephron. So the first part of the nephron is going to be the glomerular capsule. So I'm not going to use my pointer because it's too thick. So I'm going to point with my finger. These are the glomerular capsules. They're also known as Bowman's capsule. All right. And there's another name, renal corpuscle. But basically inside are the glomeruli, which is the tuft of capillaries. That's the first part of filtration that takes place over there. Okay. So the first part is the glomerular capsule. Second portion of the nephron is the proximal convoluted tubule, as you can see here. The descending loop and the ascending loop is basically the loop of Henle. And so that's the third portion. So what was the first portion? Number 1, glomerular capsule. Number 2, proximal convoluted tubule. Number 3, loop of Henle. Number 4, distal convoluted tubule. Number 5, collecting duct. So there's 5 sections to a nephron. Glomerular capsule, okay, proximal convoluted tubule, where 70% gets reabsorbed, meaning the solute, the loop of Henle, then the distal convoluted tubule, the collecting duct, and that is what a nephron is. And we have millions of those nephrons in the renal pyramid. And the final thing I want to talk about is details about the glomerulus. Now, don't forget, do you see the collecting duct? It's going to empty out into the pointy aspect, the apex of that triangle, the renal pyramid. And that apex is called the renal papilla, which feeds directly into the minor calyx, major calyx, renal pelvis, ureter, bladder, urethra. Okay? Now, let's discuss the glomerulus. So if you look at the glomerulus, don't forget, you've got the section here, the JGA apparatus, the juxtaglomerular apparatus right here. And it's going to control your glomerular filtration rate. So you got the incoming afferent and the exiting afferent, and this is what a glomerulus looks like. Okay? And that's pretty much hopefully everything that you can imagine about the urinary system. I am going to go over now the essay question that you should be thinking about how to answer as to when I ask you, please describe the blood flow in and out of the kidney and the formation of the urine. So this is how you would describe it. Oxygenated blood is coming from the left side of the heart via the aorta and entering the renal artery, which then splits up and divides into segmental. Segmental divides into interlobar. Interlobar divides into arcuate. Notice it's like a dance. Arcuate divides into cortical radiate. Cortical radiate is going to enter the nephron via the afferent arterial. Inside is the glomerulus, exiting via the efferent arterial. And then the blood flow goes through the peritubular capillary, then goes down the descending and up the ascending loop of Henle via the Vasa Recta. And by the time you come up, the blood flow is coming up the ascending loop of Henle via the Vasa Recta. The blood is now deoxygenated. The deoxygenated blood via the Vasa Recta enters the cortical radiate vein, which then is going to go into the arcuate vein, which then is going to go into the interlobar vein, which then is going to feed into the segmental vein, which then goes back up the renal vein, entering the inferior vena cava and back up to the right side of the heart. That's the blood flow through the heart. Now tell me, the second portion of that essay should describe how we form the urine. So the urine is going to start out as filtrate. Where? Right here in the glomerular capsule. The filtrate is formed. Filtration is occurring because of the glomerulus. Capillaries are exchange vessels. And you form the filtrate in the glomerular capsule, which then goes into the proximal convoluted tubule, where approximately 70% of the solute is going to get reabsorbed. Then the filtrate goes down the loop of Henle, which then goes to the distal convoluted tubule. Then the filtrate is going to enter the collecting duct, where it's going to feed into the renal papilla, where the urine is now going to exit the renal papilla into the minor calyx, right here. Minor calyx, into the major calyx, right here, into the renal pelvis, right there. Down the ureters that come down into the bladder, out the urethra, into the toilet. All right, so that's pretty much everything you need to know about urinary system. Good luck studying. May the force be with you. Bye.